Hello, everyone. All right, so let's talk about hypersensitivity reactions. So, we did not cover this in class, so let's go ahead and cover it. So, what is hypersensitivity reaction? Well, listen, I think this photo right here kind of reminds me perfectly of what it is. Um, this is that movie where Will Smith ate some shrimp, I believe. And I can't recall the name of the movie. I think it was Snitch. I think so. I'm not sure. But anyways, he gets an allergic reaction. The immune system it says, "Whoa, I'm allergic to this because of eating shrimp," and then he swells up, and his ears and his mouth and his eyes. So, anyways, this photo just makes me laugh every time I see it because of sensitivity reactions. So, when you think about sensitivity reactions, think about the immune system being in 4 power 100,000 billion energy. Like it's on 4 drive, like overdrive. It's reacting, exaggerating of the immune system. Okay, so it's an overreaction of the immune system, and it's usually related to an antigen or an allergen. Now, this allergen can be different things. It could be perhaps grass, it could be food, it could be dust, it could be like latex, it could be a medication. And so there could be different reasons why the immune system might react to an antigen or an allergen, but it does present in different ways. So it could be skin reactions like hives, or you start itching, or having inflammation of the skin, dermatitis. I could think of hives like whenever maybe you give a drug and you're allergic to the drug, okay? Or it could be maybe you're allergic to mosquitoes, okay? And then you start itching and it gets swollen, the bite, okay. Now, you do have systemic reactions where you can have very serious ones, such as anaphylaxis or angioedema. Okay. These are serious ones because the throat, your airway, your pipe sort of closes, and then you can stop breathing, right? Or you can have respiratory reactions like allergic rhinitis that we talked in class, just regular allergies, maybe because of the pollen or the grass. Or you can trigger asthma. Okay, and we'll talk about asthma in a different video, but yes, that could be another respiratory reaction related to an allergen. Now, when someone has a reaction, a hypersensitivity reaction, typically, and I'm not going to say always, but typically, usually the person reacts very quickly. We're talking about minutes. Um, but sometimes it needs for the body to kind of recognize it a couple of times, and then they start reacting. For example, let me give you a perfect example. Someone might shrimp once and maybe not feel anything, maybe have a little, kind of throat thing. But then the second time, because it's not so foreign to the immune system anymore, maybe the second time you get the full blown anaphylaxis reaction. Okay. So, yes, it can have a delayed response. What happens when someone has a reaction of the immune system? Well, first and foremost, we really need to do a very thorough CIA, FBI investigation and assess, the history on the patient, the family history, what did they eat, what are medications that they're taking, maybe what they were doing prior to the reaction, the season. If it's like dermatitis or hives, what soap are they using to wash their clothes? Yes, some people are allergic to their soap. What specific symptoms did they get? When did they notice them? What made it better? What made it worse? And sort of everything that they have eaten on that day. So, if you could think about this for a minute and let it sink in, it's a very thorough investigation and questioning because you're trying to figure out, well, could this be grass? Could it be the food? Could it be a medication? What exactly is it? Imagine you have a reaction with a client and they went outside that day, they ate shrimp, and they recently started a medication. Well, how do you know which one of the three are? That could get very, scary and hairy there. So, asking very appropriate questions is something that is going to be crucial for these patients. And then once this is, chronic or um, especially if you have a really severe reaction or you're not really sure what it is that is causing it, you have to kind of see an allergy specialist. And then they'll test you with what is called a skin test. And this bag right here that I have on the picture it's a perfect example. They literally inject um, little portions of different antigens. It could be in the form or it could be in your bag. And so, based on the little antigens that they inject, excuse me, they might be able to tell what exactly you are allergic to. This could be the most frequent or most common, not frequent, most common foods that people are allergic, nuts, fruits, etc. Or it could be like different types of grass and different types of sort of trees and whatnot. Um, for the most part, when someone goes to do an allergy testing, they need to stop any sort of allergy medications, antihistamine, steroids, because we want the immune system to react normal. We want it to go full blown in overdrive. Okay, um, so if we are taking antihistamines, like let's say a Benadryl or a Claritin, then your immune system is not going to react like it normally would. When the patient is taking the allergy testing, the skin test, we never leave them by themselves. We always have an EpiPen right next to them because if they get into a full blown anaphylactic reaction, we have to give them epinephrine right away to open up the airways. And of course, put oxygen and so just follow the whole thing. And I'll kind of talk to you here shortly what we do. Um, but yeah, I mean, once they inject you with that, that goes up to testing, and the results can be back within minutes, or you might have a delayed response, and they might take up to 48 hours. So not always your results are going to be immediate. Now, we do have allergy shots, and when we were talking about allergic rhinitis, I did mention the immunotherapy where they will give you shots of this little bit of antigen or what you are literally allergic to. And it sort of kind of makes your immune system used to it. So it desensitizes you. Immunotherapy, it's literally desensitizing your immune system to not respond so, whoa, in overdrive all the time. Um, first and foremost, we want to identify and avoid any triggers and kind of write them down. They will try antihistamines, corticosteroids, maybe topical Benadryl or topical steroid creams. And then they might go into these allergy shots or immunotherapy when drug therapy is not effective. Okay, so let's say I'm a very high reactive person that every time I go outside, I break out in hives. And they've identified that it's sort of this grass that it's grown here in Texas. I'm just giving you a hypothetically situation. Well, and every time I go outside, I get hives, swollen eyes, itchiness, maybe my throat starts scratching, and I have difficulty breathing. Well, then I won't be able to go anywhere, right? I would have to live in a bubble. So for that, maybe they'll try antihistamines and steroids, but then that doesn't work. So when all have failed, then I might start getting, or I might be eligible to do these allergy shots with the little antigen and allergen, and slowly, in very small amounts, introduce it to my body so it can desensitize my immune system. Typically, they're given sub-Q or sublingual, and you literally start with very small doses, and you keep an EpiPen on them at all times because, again, you don't know how the immune system is going to act, and you might need, epinephrine. And then they start increasing slowly, the dose or the amount, the strength. Um, in order to see kind of what your immune system is going to do, and hopefully the reaction will be less and less. But the chances of reacting is higher if you increase the strength, of course. So let's talk about anaphylaxis. Well, anaphylaxis is an emergency, okay? This is a reaction of the immune system that happens within minutes. It's life-threatening. People can and have lost their life because their bronchi close up completely. They have complete airway obstruction, and we have a vascular collapse. Like literally you have this shock that happens, blood pressure drops and everything else. So it's very deadly. So some of the symptoms that someone could experience, and they might have two or three of these, or they might have all of them, okay? Depends on the individual. Um, it's swelling, itching. You have hypotension, your pupils dilate, you have sort of a weak pulse, you have shortness of breath, retractions. Um, it could be everything swollen from your lips to your tongue to your eyes and ears. So imagine if someone is so swollen up like this that yeah, they can't breathe, and basically we got to act right away. I think about anaphylaxis as the worst of the worst of the worst. It's like whenever maybe you have an accident in I-30, and first you might have a couple of cars that stopped, and then you have like 20 cop cars, 20 fire trucks, and ambulance, and then the helicopter. It's like everybody comes up, it's like really emergency. So what can cause anaphylaxis? Well, there could be many reasons, okay? A lot of people have anaphylactic reactions with medications like aspirin or insulin, penicillin. Um, Also, foods. A lot of people are allergic to eggs, milk, peanuts, strawberries, shellfish, blood transfusions as well. Iodine. Many people are allergic to iodines, including also not last and least, but including animals. So insects or maybe a bite from a snake or a bee sting, etc. All right, so what happens? How do we treat it then? Well, the first and the most important thing is that you have to think about your ABCs: airway, breathing, and circulation. And your first thing that you need to ensure is that the client has an open airway. Now, if the client is not breathing, we need to make sure that we get them breathing, right? If there's no oxygen, there's nothing. And so that could either be because you are doing an intubation or you push epinephrine on them to kind of sort of help them breathe. And the epinephrine is intramuscular. It's usually between zero point 0.3 and zero point 0.5 milligrams, and you can repeat epinephrine every 5 to 15 minutes. Um, we do use albuterol to open up the pipes, okay? That way they can continue to breathe. I don't administer oxygen immediately. Not that it's not needed. You do. I'm just saying, like, think about this. If you give them oxygen immediately, but their pipe is completely closed off, then oxygen is not going to get to them. But if you do sort of all this, like maintain their airway, give them epi, give them as soon as possible albuterol with something to stop the immune system from reacting, then they might receive a little bit better of the oxygen. Now, in an NCLEX world, um, let's say they say, what would be your priority action? And they give you, um, which it's, we're not going to try to trick you like that. But when you do all these in all simultaneously, like, oh, intubate, epi, albuterol, oxygen, which is the priority? Well, they're all priority, okay? We usually don't try to trick you that way because we know that, hey, you might need epi, but yeah, you might be doing oxygen at the same time as you are doing albuterol. Um, so, but anyways, that's just kind of me giving you my 2 cents on that. Um, Another thing that we do is steroids, just because we want to relieve that inflammation that can cause from the immune system responding. We want to give them oxygen as needed. It could be through intubation, it could be through just a high flow oxygen or a face mask. And then treat the shock because they will have hypotension and thready, weak pulse. So you might be giving them fluids like boluses of fluid, position them um, in a recumbent position, kind of with their head down and their legs elevated to help with that hypotension. Some things to consider are, well, if it's a snake bite, you might have to put a tourniquet so the poison doesn't continue to spread. If it's a bee, like an insect or an animal, then you might have to remove that stinger. And then frequent monitoring of the vital signs and level of consciousness. Another thing that is important is to really educate our clients on how to use an EpiPen. You'd be surprised, not many people know how to use an EpiPen. So we have to let them know what is an EpiPen used for, when to use it, what to check for before you use it, and then also how to use it. So epi is to treat anaphylactic reaction, any severe reaction of the immune system. Patients need to have it at all times. They need to check the expiration time or date because if it's expired, they need to get a new one. Not only does your patient need to know where it is, but those close to the patient need to know where it is. Like if, let's say, my women carry it in on their purse, or maybe you have one in your gym bag, or maybe you store it in the house in the kitchen. Just anybody, friends, family, fiancés, anyone that is close to you, especially if you have or you're prone to severe reactions of the immune system. Let me give you a scenario. So let's say I am allergic to shellfish, and I go to this restaurant, and accidentally there's some cross contamination with shrimp or scallops. And I go eat my chicken, for example, and for some reason I'm reacting to it because it got mixed with the shrimp. Just giving you a scenario here. And then I start reacting in the restaurant. Well, maybe I might not be able to talk, but my person that is with me should know where's my pen and or how to give it to me. Okay. So this little brochure here sort of tells you, you kind of have to grab that cap and then pull it out. The orange sort of goes, in your thigh, and it could go through clothes. It's always injected in your thigh, intramuscular, and then you sort of leave it there until it's completely finished, and it sort of makes like a little clicking noise. So you have to hold it in place for a few seconds until the whole medication is administered into the muscle. And then in that time you're calling 911, and you can repeat more doses every 5 to 15 minutes until EMS gets there. Okay, so those are some important things, and I believe the teaching is in your book on one of the pages. I believe it's 225, so I would review that just so you know and how to teach it. All right, so let's talk about excuse me, latex. Latex, latex allergy is kind of becoming more and more popular, or more people are allergic to latex nowadays, but that's because of the more frequent use in things containing latex. Although now, because a lot of people are allergic to it, you're going to see more latex-free supplies here in the hospital. But it was mainly due to the frequent use of latex gloves. There are two different types of reactions that an individual can get with latex. They could get asthma, hives, or redness, but they could also have skin reactions, like they get like dry and crackly and really itchy on the side that latex was in contact with. Um, Pretty much, you kind of want to always ask your patients, always ask your patients about drug allergy, but also latex allergy, and document that. Um, Educate the patient whether they have a latex allergy or any type of allergy to wear a medic alert bracelet, carry their EpiPen on them, and then be aware that um, the rubber within the latex, there are some what we call latex food syndromes. And so what that is that, there's some proteins in the rubber that are very similar to foods. And there are some foods that are more common for having this reaction. And so if you have someone with a latex allergy, you do want to avoid, for example, bananas. And you'll see that most of them will say, I'm allergic to bananas, and also I am a latex allergy or have a latex allergy. So some of the foods that are common are bananas, avocado, cashews, kiwi, tomatoes. They're listed there. Just kind of giving you, the more sort of common shellfish, grapes. You want to avoid them at all costs and try to avoid that cross contamination and any exposure to it. I mean, there's some people that are so allergic to bananas that even just being near them or maybe getting them in their skin could cause some sort of reaction. Okay. As always, my references are from the book, all images from Google or the book. I hope this was helpful, and I'll see you on the next lecture.